Today we have a lection about anesthesia. It's the second lecture, if I right remember, and we will talk today about local anesthesia. This is a small lection. Please be worried or don't be worried, but have a lot of attention. Okay, when you're hearing anesthesia, you are a child of future, yeah, and you every time see serials, TV serials, yeah, films and other production of TV, and for example, I when see anesthesia, I in my mind see this picture that some people will give me a mask, yeah, and I go sleep. Today we will talk about another type of anesthesia, and local anesthesia. When somebody say me about local anesthesia, I see in my mind this picture, and you see there a skin. You see a skin. When we do a local anesthesia, when we talk about local anesthesia, we always talk about skin, and when I think about local anesthesia, I think about syringe and some kind of drugs what we will include on under the skin. What it means? When we talk about local anesthesia, it is a reversible elimination of pain sensitivity in a certain part of the body caused by the action of special medicaments. For example, if we have this syringe, yeah, and we include some influence some drug to this place, we will have a local anesthesia of this place. Okay, what's the indications for local anesthesia? First of all, when we talk about local anesthesia, we need to understand that it is something another like general anesthesia. Yes, and if we have a big arsenal of the guns, yeah, the most big guns, it's a general anesthesia, and the small gun, it is a local anesthesia. And indications for and there you will see not only indications of the local anesthesia, but you see some positive property of the local anesthesia. But first of all, we don't need to have special long-term preoperative preparation of patient. The second one, if we have some contraindications for general anesthesia, these contraindications don't contraindicate a local anesthesia. After our operation, we don't need to observe patient after post-operative period. All local anesthesia do in outpatient basis, yeah, in ambulatory, because when we talk about local anesthesia, we don't talk about many techniques, yeah, many machines, just a syringe, yes, just drug, and just arm of surgery. Uh, and the last one, if we have high risk to life when we do a general anesthesia, it is indication for local anesthesia. What about contraindications? First, look, when I prepare this topic, I found some results of contraindications, and I don't agree with these contraindications, but I won't say this for you. First of all, it's patient intolerance to anesthetic agents due to increased individual sensitivity. Yeah, we called it allergic. And if we talk about allergic, I agree with these contraindications. The next contraindication what I found, it's age less than 10 years. But there I don't agree. I know many surgeons, many child surgeons, and they do a local anesthesia for patients, small patients. The third one, the presence of mental disorders in patients who have an excitability nervous system. But this, I don't agree with this, because if patient have with non-stability nervous system, we need to do them a local anesthesia, and it's not a not right position, how I think. The fourth, the presence of inflammatory or scarring changes in the tissues that prevent the implementation of infiltration anesthesia. I think that it's not a 100% contraindication. Yes, sometimes we have patients with moderations, yeah, but they have some problem, and we need to do them local anesthesia. We can try do it, yeah, and of course, if they haven't got a painkiller effect, we will do them some another. And the last one, it's ongoing internal bleeding that requires urgent surgery to stop. This is very non-understandable for me. Of course, if patient have bleeding, internal bleeding, we need to do him a operation, big operation with general anesthesia. And when we talk about indications for local anesthesia, we don't see that internal bleeding is an indication for local anesthesia, yeah? And this is non-understandable for me why it is contraindication. Why of course it is contraindication. No, it's non-understandable for me. Don't worry about this. Remember that contraindications is allergic reaction. The next one picture, you see a medicines what we use in, we see drugs, yeah, medicine or drugs what we use in hospital. In our hospital we use these drugs, two drugs. Most often we use novocaine solution, and sometimes when we have it we use lidocaine. Of course this one is better, better. And now I will talk with you about solution of novocaine. It is a moderate anesthetic, and he do activity blocks of channels of natrium. Then reduces the excitability of peripheral cholinergic systems, reduces the formation and release of systems of acetylcholine systems from preganglionic ending culminates smooth muscle spasm, reduces the excitability of the myocardium and motor cortex, depresses polysynaptic reflexes in large doses. It can cause seizures. It has a short anesthetic activity, duration of infiltration anesthesia, time of anesthesia 1 hour or 30 minutes. Novocaine. About concentration of novocaine, we have some other dosage. Remember that you see a dose, concentration of solution, yeah, and you see it there too. When we talk about dosation or concentration in patient, yeah, we can do more than 0.75 grams, and when we talk about starting of operation, and when we talk about all operation, we can do more than 2 grams. Side effects. From the central and peripheral nervous systems, we have a headache, dizziness, drowsiness, weakness, and trismus. When we talk about cardiovascular system, it is increased of pressure of blood pressure, or sometimes we have decreased of blood pressure. Peripheral vasodilatation, collapse, bradycardia, arrhythmias, chest pain, and that's all. When we talk about hematopoietic organs, there we can talk about methemoglobin ME. When we talk about allergic reaction, it can be itching of the skin, skin rash, other anaphylactic reactions, including and we include anaphylactic shock, urticaria. It is skin and mucous membranes. The next one. We need to talk about types of local anesthesia. We have infiltration anesthesia, conduction anesthesia, spinal anesthesia, and surface anesthesia. Local anesthesia are used in various ways, including by soaking tissues. For example, infiltration anesthesia. Or when we do injection to a nerve branch containing, it comes from the area that needs to be anesthetized. It's a conduction anesthesia or spinal anesthesia of segmental posterior roots. Or sometimes we apply to the surface of the skin or mucous membrane. It is a surface anesthesia. In each case, a local anesthesia diffuses to the nerves from a depot formed in the tissue or on the skin. Lemon peel. There you see some purple, yeah, what looks like lemon peel. There you can see a video where I do a lemon peel, where I do a local anesthesia, and you see then when we do incision, um, when we see a needle coming down of skin or in skin, no, down of skin, you see this small bubble. Yeah? It means that uh, all all drugs what is in syringe come down on skin, and we have anesthesia in this place. We can do a cut there. Okay, please look this video. That's all what I want to say you today. Now we will marking your knowledge, yeah, with small tests. What you need write in comments. First one, conjunctional anesthesia of the finger according to Lukashevich-Oberst. You need look in internet, or you can look this video, yes, to understand what is this and how we can do it and what it give us when we do some local anesthesia. Please write in comments first answer what is this conjunctional anesthesia of the finger according to Lukashevich-Oberst. The second question, it is intracellular anesthesia. What is this? I want from you. Third one, what is early complication in postoperative period? Fourth, classification according to urgency. It's classification of operation. Yes, 3 types of operation. Please write in comments. And fifth, components of anesthesia. You need to remember what components have all types of anesthesia. Okay, thank you for your attention. Have a nice day, and I want trust that this lection was interesting for you. Bye bye, guys.